So today we will studying the tricyclic antidepressants. So it includes the drugs with the name ipramines and the triptylines. The first one is the imipramine, second is the desipramine, clomipramine, nortriptyline, and the amitriptyline. So what is their mode of action? Their mode of action is same as SNRIs, that is they block the reuptake, of norepinephrine and the serotonin. So here the question arises that if we have the SSRIs and SNRIs, then why we use the tricyclic antidepressants? So we use the tricyclic antidepressants because they have, when the patient is resistant to the SSRIs and SNRIs, so we use the tricyclic antidepressants for them. The tricyclic antidepressants were first used as the antidepressants, but they are now not used because of their lethal dose and the side effects. They have very vast side effects, and the second problem is that they have very small lethal dose, which means that if you get a small amount of drug, then it may cause the toxicity and may lead to death. So we have said that the tricyclic antidepressants act just like the SNRIs. They cause the reuptake of the norepinephrine and the serotonin. So here are its same or common effects, that is it treats depression by causing the reuptake of the blockade of the reuptake of the norepinephrine and the serotonin. Secondly, it can treat the neuropathic pain, which mainly occurs in the diabetes patients. Thirdly, also its high dose causes the serotonin syndrome. Just like the SNRIs. And the other point is that it also causes the sexual dysfunctions like the SNRIs. And it also treats the OCD just like the SNRI, mainly the clomipramine. Clomipramine is the main agent. So it's one extra good effect is that the SNRI doesn't we do not use SNRI for the migraine prophylaxis, but we can use the TCAs as the migraine prophylaxis, mainly the amitriptyline. So now we will discuss the side effects that the TCAs have but the SNRIs do not have. The first one main side effect is that they are antimuscarinic. The TCAs are antimuscarinic, unlike the SNRIs. Secondly, they are antihistaminic, and thirdly, they are anti-adrenergic, mainly the anti-alpha adrenergic. So they have some related side effects to them. So they are the antimuscarinic, so they have the following side effects. They cause the dry mouth condition, they cause constipation, they cause the urinary retention, they cause the blurred vision due to the mydriasis or the pupil dilation. Due to their antihistaminic nature, they causes the increase in the appetite, so they cause the weight gain. So the third side effect is that the tricyclic antidepressants are the anti-alpha adrenergic. So as they are anti-alpha adrenergic, so they causes the postural or the orthostatic hypotension. What does it mean? The alpha 1 adrenergic receptors, when they are stimulated, they causes the vasoconstriction in lower limb. So the postural or the orthostatic hypotension is a condition in which there is a decrease in the blood pressure when we change our position from the lying position to the standing position. The normal physiology is that when we change our position from lying to the standing position, the blood flushes into our lower limbs. So at that time the alpha adrenergic receptors are activated or stimulated, so they cause there was a constriction in the lower limbs. So less blood is allowed towards the lower limbs, and the valvular walls are activated. So when they block, the TCAs block the alpha adrenergic receptors, there is no vasoconstriction in the lower limbs, so the blood pools up in the lower limbs. So there is more blood flow towards the lower limbs, and there is low cardiac output, and there is less blood going towards the brain. So if there is less blood going towards the brain, then it causes the syncope, or we can also say this फिर हमें चक्कर आते हैं इसी वजह से. So this was all about the tricyclic antidepressants.